Could you tell me a little bit about why I'm here today and what's going on?
I have a nosebleed.
You have a nosebleed?
Yeah.
So what I'll get you to do firstly is just tilt your head forward for me and just pinch the bridge of your nose. Can I just have a look at the tissue just to see how much blood you produce? Cool, so not too much. So there's mild flow. At this stage it looks like it's seemingly stopped. But what I'm just going to do is get a couple of questions about the patient's history and so on and so forth. So what's your health history? Are you on any anticoagulants? Are you on like warfarin or aspirin?
No.
Have you ever taken that medication before?
No, not to my knowledge.
Okay, have you taken any nasal decongestants?
Only in winter.
Only in winter? Okay. Have you taken any cold or flu medicines or any hay fever medication or anything like that?
Today?
Today? Yes.
Just an antihistamine.
Just an antihistamine, okay. You haven't hit your head or anything today? You haven't slipped over?
No.
No? Okie dokie.
Just stomped my nose.
Just stomped your nose? Okay. Can I just have a look at it? Just hold the tissue just below, and what I'm going to do is, if it's alright, I'm just going to touch your face and I'm just going to do a little assessment. Okay. It doesn't seem to be broken. Is it tender around there?
Yes.
Yeah. Okay. Do you normally commonly get nosebleeds?
No.
No? Okay. Is this the first one you've ever experienced?
Yes.
Okie dokie. Does anyone in your family have a history of blood noses or anything like that?
No, not that I know of.
No, not that you know of? Okie dokie. So, my cause of concern that I'm worried about is obviously if you've hit your head, then I'm going to be concerned. Also, your age range, if you're older than 70 and you're on anticoagulants, that's a cause for concern. But you're also not under 10 years old as well. Do you have any malformations of like blood vessels or any blood vessel conditions or anything like that?
I just take longer to clot.
Just take a little bit longer to clot, so you do suffer from some form of haemophilia?
Yeah.
Okay. So what we're going to be concerned about, obviously, is just making sure that that clot does stop. If the bleeding does stop, then what we'll do is I'll observe you before we head off. However, if the patient's nose was continuing to bleed, then what we'd do is we'd move on to atomised adrenaline on the site, which would be 0.2 milligrams per nostril of atomised adrenaline. Have you ever had adrenaline before?
No.
No, you've never been treated for this either?
No.
Okay, cool. So what we're going to do is I'm just going to have another check. I'll get you to pinch the bridge of your nose for me, and I'll get you to switch out the tissue. You've got a box of tissues there, so I'll just get you to grab another tissue and I'll hold that one for you. Yeah. Cool. So at this stage, I think it's stopping. Okay, so the first thing we want to do is just make sure you're leaning over. They're getting a good height, yeah. We don't want to lean it back, otherwise what we're going to cause is pulling of blood in the back of the throat. And we're also just going to make sure we're pincing just the bridge of our nose, not the bony part. Another thing I'd like to also just quickly show you as well is this here is our management of epistaxis or nosebleed. It's a little bit of a guideline to how you can manage it. Obviously it's a really concerning thing that a lot of people worry about, but in the community we see it a lot, and it's not too dangerous, especially with your presentation. I'm quite happy to leave you at home today. What it goes through obviously is it's what is epistaxis, or what is the bleeding nose caused by. It goes what to do and step-by-step guides. It's also got when to seek medical advice, and that's really, really important as well. Do you have any allergies, like hay fever or anything like that?
No.
No? Okay. Some other things there are what not to do. So obviously don't pinch the bony part of your nose. Never tilt your head back, because that's a big concern for us. Don't remove clots as well. So if you've got blood clots that are in your nose, you don't want to be removing those. And you don't want to fill your nose with tissues or anything like that. That's going to block them, because what that means is when you pull them out, you're removing that clotting factor, and it can start to bleed again. Do you smoke?
No.
No, you don't smoke. You don't have been picking your nose too much today or anything like that?
No.
Okay. If you were, then what we'd recommend is just cutting back and possibly looking at like smoking cessation and stuff, but because you don't smoke, that's not a risk
My
factor
partner
for you.
smokes.
Your partner smokes. That can be a causal factor for it, so it might be something you need to have a discussion with your partner, but also it's something you can look at is going to a GP and just having a discussion with them about maybe some cessation of smoking. Obviously I'm going to observe Kayla. I've taken her vital signs. There's no abnormalities to her vital signs, and I'm quite happy with the presentation. Just a couple of things we'll get you to do is we'll get you to put that tissue down. Okay, do you feel dizzy at all?
No.
No? Are you in any sort of pain?
Just uncomfortable.
Yeah. Can you still breathe in through your nostrils? A little bit?
Yes.
Cool. Don't try too hard. Your breathing's not laboured or anything like that? Okay. So I'm just going to pull my CPGs out. Obviously there's no transport red flags for epistaxis, but there is a checklist for the non-transports. So I've fully assessed Kayla's vital signs, and I'm appropriate with my investigations. There's no abnormal vital signs. because of my questioning and also the vital signs themselves, I'm not led to believe there's a serious illness or injury. There are no red flags. What I want to say is, would you be able to just go up and grab and touch the table for me and just come back down and take a seat for me? Cool. You don't feel dizzy at all?
No.
No? Okay. And just come back and just come take a seat when you're ready. Cool. Is this your sister here?
Yes.
Cool. So just before I leave, I'm just going to get you just to monitor your sister. What I'm also going to want you to do is if she feels dizzy or she changes colour or just goes abnormal, just give the doctor a call or give us a call back and we can come straight back. I'm quite happy to leave you at home if you're comfortable.
Yeah.
Are you comfortable? Cool. I'm going to leave you with a little form. It's going to give you a little idea. I'll also leave you with the management plan there as well. If you have any changes or any questions, give your GP a call and go and book in to see them and so on and so forth. Okay. So I've done that, and I'll give you a copy of your patient report form, and I'm happy with that. Do you have any questions for me?
No.
So today we've been dispatched to a residential address. The patient's in their room. So Kayla, can you tell me a little bit about what's going on today?
I've got a really bad headache.
A really bad headache?
Yeah.
Yeah. How long have you been experiencing this for?
Most of the day, but it's come on worse.
So it's been fluctuating?
It's been there, but it just got on worse and worse throughout the day.
Yeah. When would you say the symptoms have got started?
This morning.
Yeah. Do you roughly what time?
Probably mid-morning,
Yeah.
11 o'clock.
Yep, so it's just been gradually building?
Yeah.
You haven't hit your head or anything like that?
No.
Okay. So just location-wise, where's the location of the pain?
Mainly over my left eye.
Yeah.
Area.
Just
Above it.
just on one area?
Yeah.
It doesn't jump or move around,
No,
does it?
it's consistent.
Okie dokie. Have you taken any medication or anything like that today?
Not in the last couple of hours.
Yeah. What are some symptoms that you're suffering from?
The light, very, very sore from the light.
Is that why the room's quite dark?
Yeah, yeah. And quite nauseated with it too.
Yeah. Have you been vomiting?
No, I haven't. Just very nauseous.
Okay. I've got a couple of questions and I'm just going to ask you a couple of red flags. So just tell me a little bit, have you ever experienced anything like this before?
Yes, probably about once before.
Once before? How long ago was that?
A few years ago.
A few years ago?
Yeah.
Yeah. Okay. So upon examining the patient's vital signs, there's no temperature variations or anything like that. There's no abnormal vital signs. All of the indications for an infection or traumatic brain injury or thing have been ruled out. Have you ever had any family members who have had associated pains or anything like that?
In what terms?
And so have you ever had family members who suffer from like migraines or anything like that?
My auntie.
Yeah. Okay. On a pain scale, 0 being no pain at all, 10 being shark biting your arm off, where would you sit round about?
At the moment?
Yep.
Probably about a 7.
Okay. What tends to relieve your symptoms?
No light.
No light?
And laying down.
Yep. Have you been getting like good sleep and
Intermittently, yes.
yep. How much water would you say you've drunken today?
Not too much today, but enough.
Okay. I apologise for asking, has there been any sexual activity or anything today that's could be considered strenuous or anything like that?
No.
No? Okay. Obviously, if it was, have you ever experienced anything like this regarding like your period or anything
No.
like that? No? Okay. So it's quite new to you?
Yeah.
Alrighty. I can't remember, did you take any pain relief today?
Not in the last 4 hours.
Not in
it's
the last
been
4 hours.
earlier
Okay.
today.
Any reason why you haven't taken anything?
Just haven't had a chance to yet.
Okay. So what have you got medication-wise?
I've got some paracetamol, some Nurofen.
Yeah, so ibuprofen?
Yeah, and I've got some like codeine.
Alrighty. So what we might do is, if you're comfortable too, we're going to set you up. I'll get you to put your feet on the edge of the bed. I'm just going to do a little fast examination, just to check some things. So if you could just hop over. How are you feeling at the moment?
Bit dizzy.
Bit dizzy? Alrighty. Dizziness-wise, 0 being not dizzy at all, 10 being like you're about to fall over, where would you sit?
Probably about a 4, just like, no, I'm dizzy. But
Okay, cool. So what I'm going to get you to do is I'm going to get you to grab my hands, just squeeze them nice and tight for me. Cool, nice, as hard as you can. Good, that's what we want. Now I want you to close your eyes and just stick your hands out in front of you. Yeah, very nice. Okay, you can put your hands down. So obviously, I'd be wearing my if the patient was dirty or if there was a consideration of risk, then I'd be wearing gloves. However, if the patient's comfortable, are you happy if I just feel you touch your face?
that's fine.
Cool. Okay. Do you have any pain associated in your face here?
No.
No? Okay. Any pain up here?
Bit tender.
A bit tender?
Yeah.
What about up here?
Again, just tender on the left side.
Cool. Just on that left side there?
Yeah.
Okay. Are you able to put your chin on your chest? Yeah?
Yeah.
Does that cause any discomfort or anything like that?
No.
Cool. Right back like that. Okay. Can you tilt it to your right?
Wrong way.
And to your left. That's alright. Cool. Just going to feel your shoulders. Is there any pain in here?
No.
No? Any pain in the back here?
No.
No? You haven't had any falls or anything?
No,
recently?
no falls.
Okay. So after assessing and questioning Kayla, I'm quite comfortable that this is a migraine. To get on top of her pain, we're going to provide her with some pain relief, which will consist of paracetamol, ibuprofen for the pain, and then ondansetron for the nausea and vomiting. So firstly, just getting a pain score from Kayla. 0 being no pain at all, 10 being the worst pain you've ever faced. Where would you say you sit?
Probably about 7.
Probably about
Yeah.
7? Okie dokie. So have you ever had paracetamol before?
Yeah, I have.
Yep. What about ibuprofen?
Yeah.
Okay. So have you got any allergies to paracetamol?
No.
No? With Brufen, have you got any severe allergies to ibuprofen?
No.
No? Okay. Do you have any kidney or liver disease or dysfunction?
No.
No? Okay. And have you ever had ondansetron before?
I think so.
Yep. Tastes a bit strawberry under your tongue. You
Yeah.
just let it sit. Okay. So what I've got here is I've got some paracetamol, ibuprofen and some ondansetron. The patient has got some ondansetron, so we'll use the patient's ondansetron, obviously doing drug checks as well. So I'm going to just check this myself. Paracetamol, 500 milligrams, expiry date 10th, 2022. Okay. I would then pass this to my officer to check, confirming that it is paracetamol, that it's in date, and it is the right dose as well. Okay. So what I'm going to do is I'm going to give you 2 of these. Okay. So I'm going to give you 1 gram. Of paracetamol. Is it alright if I pop this into your hand? Yeah. Okay, just leave those 2 there. Cool. Are you under 80, do you weigh over 80 kgs
No.
or over? Under? Cool. If the patient was over 80 kgs, I give an extra, another 500 to bring it to 1.5 grams. Okay, next I'm going to check the ibuprofen, making sure that this is in date, that it's the right dose, right medication. Cool. I then pass that to my officer to check and confirm that with me by verbalising that aloud. Okay. What I'm going to give you is I'm going to give you 4 milligrams of of ibuprofen, which will be 400 milligrams of ibuprofen, which I'm going to pop into you now. Cool. If I get you to take those with me, do you want to grab your glass of water?
I can use
You
it.
use a drink bottle? Cool. And once you've taken that, what we can do is we'll then give you the ondansetron as well. Okay. So the patient's now taken them. I'm finally going to just check indications and contraindications of ondansetron. Are you in the 3rd trimester of pregnancy?
No.
Do you believe you're pregnant
No.
at all? Okay. No known allergies to ondansetron?
No.
Okay. I'm going to give you 4 milligrams, which is just 1 tablet of these. Okay, I'm just going to pop that into your hand now. Okay, here we are. Cool. So if you could take those for me. They will take a little bit to kick in. But once they do, then we can reassess your pain. After a few minutes, 2 to 3 minutes, 4 minutes, I'll reassess pain score with Kayla. The other one as well is get in touch with your GP within 24 hours, and if this is something that commonly occurs, they can put you on triptans, which is another form of pain relief, which works really, really well. The reason I gave you the paracetamol and ibuprofen is because clinically they work much better hand in hand rather than individually. So if you're buying it from a supermarket or your pharmacist, get both rather than one.
Okay,
to work
that's
better.
good to know.
Cool.
And can I take them both together every time?
Yep, you can take them both together every time, just conforming to the amounts required on the bag. Don't overdo that.
Yeah.
And space it to every 4 hours for your paracetamol and your ibuprofen together. Like that with you. What I've also got here as well is a little patient information leaflet. So basically this gives you an indication of what a migraine is, a brief overview of it. It'll also give you a couple of symptoms, okay, that you might recognise. It's also got a couple more there as well. It gives you some management ideas as well of how to manage, such as eating regularly, hydrating appropriately. Also when to seek medical assistance. And what I'll also leave you with is a patient report form, which you can bring into your GP. So I'd suggest booking to seeing your GP within the next 24 hours. However, if anything else changes and it gets worse, then just give us a call back and we can come in. Are you comfortable with that? Okay. So finally, after assessing Kayla's condition, her symptoms, her presentation, and providing her with medication, and then also with the information sheet as well, which is sitting next to her, then I can ask about other things that can cause issues, such as smoking and things like that. Have you ever considered, do you smoke?
Yeah, I do.
You do smoke? Okay. Have you ever considered quitting?
I actually was thinking about it.
Yeah, good. It's a healthy alternative to quit smoking. Have you ever reached out for help before?
No, I haven't.
No?
Turned it down.
Turned it down? Okay. What sort of help have you gotten previously?
None. This is the first time.
Okay, cool. So there's two ways we can go about this. We can put the onus on the patient sometimes and get them to contact people. However, probably the best and easiest method is on the ACS form I can type in making a connection to cessation of smoking. What that means is when you go see your GP next time, if you hand them a form, it'll bring up a little thing and let them know that you're interested in quitting smoking.
Awesome.
Yep. So it kind of just takes it out of your hands and it can put it in the hands of the medical professional.
Yeah.
What that means is that he can provide you with working groups that you can talk to, also pharmaceuticals such as nicotine patches,
Oh, yeah.
nicotine spray or lozenges, and that helps ease some of the tensions and needs for smoking.
Yeah.
Okay.
Awesome.
Another one as well is on the sheet I've connected the contact line as well. So when you have urges or you have any questions after I've left, you can give them a call and just ask them anything about smoking and stuff like that. But go see your GP in the next 24 hours. Okay. I'd book in tomorrow morning, get a good night's sleep. Keep the room nice and dark, okay, and just keep on top of that pain medication.
Okay.
And then go see your GP in the morning.
Okay.
And we can go from there.